Hello, all, and welcome to the Bloodstream Podcast, a show serving the greater bleeding disorders community, brought to you by Bloodstream Media and Believe Limited, and made possible thanks to our presenting sponsor, Takeda. I am your patient advocate and host, Patrick James Lynch.
And I'm your healthcare advocate, nonprofit nerd, and your other host, Amy Board, reminding you to please speak with a healthcare professional before making any treatment decisions.
On today's show, the Division of Blood Disorders at the Centers for Disease Control and Prevention, also known as the CDC, has been eliminated. What will the effect on the bleeding disorders community be? We are exploring that today. The news has already caused a great deal of anxiety, so we've invited Johanna Gray, a principal from the Artemis Policy Group, a health policy firm in Washington, D.C., to join the show to explain what is going on and how we can make our voices heard. Jo serves as a federal policy advisor to the National Bleeding Disorders Foundation, NBDF, as well as to the Hemophilia Alliance. We have got all of that and, yes, even more on today's episode. Welcome to Bloodstream.
Listeners, today is a big episode, so we want you to share this thing.
Yes, please.
Please share it loud, share it wide with friends and family on social media. And if you haven't already, subscribe to the Bloodstream Podcast so you can stay up to date on all the stuff that's shaken out in Washington.
I also want to remind you, dear listeners, that the Bloodstream Podcast is indeed made possible thanks to our presenting sponsor, Takeda.
Takeda!
That's right, Takeda. Takeda has got this website, bleedingdisorders.com, where you can learn all about Takeda's resources for and commitment to the bleeding disorders community. Takeda, get this, Amy, believes in a world free of bleeds.
We love.
And they are dedicated more than ever in their efforts to offer a wide range of programs and support to help patients throughout their treatment journey, wherever on that journey they may be. And you can learn more by simply visiting bleedingdisorders.com. One more time, that is bleedingdisorders with an S.com. And for their founding and ongoing support of the Bloodstream Podcast, I would just like to say thanks, Takeda.
Thank you, Takeda.
And listeners, I also want to reiterate an announcement made previously here on Bloodstream. GeneVentive, a biotech company exploring novel approaches to gene therapy for hemophilia A, is asking for your help in shaping the narrative. Specifically, there are some in the investor and venture capitalist community that don't believe hemophilia is in need of additional drug development. Can you believe that, Amy Board?
Great.
They don't believe
Crazy.
it. Well, guess what? They believe we're all set over here in Hemoland, and we know that's not true. So you can help make the case by filling out GeneVentive's patient survey, linked here in the program notes or description for this episode. Help shape the future of hemophilia treatment, complete the survey, and make your voice heard today. All right, so big episode, as you said, Amy Board. There are
episode.
two observations that I would like to make, one of which is very advocacy aligned, one of which is just quite personal. So we're recording this on Tuesday, April 8th, 2025, and 35 years ago today, on April 8th, 1990, Ryan White passed away. It is 35 years to the day that Ryan White passed away, which also means that in 3 days, or the day that this episode will come out on April 11th, 2007, it is the 18th anniversary of my younger brother Adam passing away at 18, the same age as Ryan. So this week also always has a little unique meaning to me.
Yeah.
And I just wanted to recognize both Ryan and Adam's passing and those anniversaries here at the top of the podcast. Love to you both.
And both of those young men were such instrumental pieces of our community and our community's advocacy. Ryan White, obviously, and your brother in what you have done in his legacy, which really transitions, I think, fairly well to our next topic. I'd be shocked if some of our listeners hasn't heard. Of course, we haven't heard this from the news, really.
Right.
It's just, it's been, if you're tapped into NBDF, if you're tapped into HFA, you know that the CDC Division of Blood Disorders has been officially eliminated. And it's causing a lot of confusion. It's causing a lot of anxiety. These are programs that have been instrumental to our community. They've been foundational to our community. They've been there since the 80s. And it's causing a lot of questions about why and what will happen. And anyway, I just think it is It just kind of blows my mind that this is happening. I guess from a patient's point of view, like what
Ooh,
was it like listening and hearing this?
there's just a lot of despair.
Mm,
And across all the different projects we work on with various colleagues, many of whom are involved in research or are supported in one way or another by federal funding, learning that they've lost their project, they've lost their job, they've lost their division of their, company, um, is extremely unsettling. I mean, it does to a degree feel to me like the sky is falling. I don't want
mhm,
to be dramatic about it, but
mhm.
I also ask myself, at what point are we supposed to start getting worried?
Yeah.
You know, of course, when the new administration took office back in January and the Department of Government Efficiency, or DOGE, was first installed, and there were all these sweeping cuts and things that you'd hear about, I thought, well, this is going to affect us in some way, shape, or form, and it seems as though it's beginning to. But
Mhm.
for me, Amy, I wanted us to bring someone on, and we've brought Johanna on today because I have felt anxious. I have felt nervous, and I don't know what this means. So I think we here in Bloodstream have a responsibility to, as
Mhm.
best we can, help listeners understand the moment we're in and what it means for our community. But we couldn't really do that today without bringing on the right kind of expert voice. So could you give listeners a little bit of background? Who is Johanna Gray? And then we'll get into the conversation.
Y'all listeners, if you guys have been at Washington Days, you know Johanna Gray. She is our principal lobbyist. She was one of the founders of the Artemis Policy Group. It's a health policy firm in Washington, D.C. Among other organizations that she serves, she has served as the federal policy advisor to the National Bleeding Disorders Foundation since 2007. And she's also been the policy advisor to the Hemophilia Alliance since 2011.
Yeah, longstanding in both for both
Long-standing
organizations.
with Ellen Riker, who is her co-founder at Artemis Policy Group. She's one of my favorite people. She explains the issues in such a gentle, very direct, clear way. We thought she was the perfect person to come in and kind of talk about this. As you know, a lot of these cuts you're not hearing about
Right.
in national news. And even though this has been instrumental in our community, we have advocated for it. If you go to Washington Days, we advocate for this program and this funding stream every single year. It's still a big, gray area of what this actually is. So we're so excited to have Johanna Gray here to tell us all about it.
Yeah, which she will now. And then Amy and I will be back on the other side to discuss a little bit about what it meant for each of us. So, Johanna, to start, thank you for being here. Appreciate your time and your expertise.
My pleasure. I wish we had something more fun to talk about.
Yeah, that's the problem with your expertise is it seems to beckon us to reach out to you during urgent, critical,
Yeah.
community-wide shattering issues. But we'll try to call you in for some of our fluffier segments at some point. That is not what we're here for today.
Mm.
Although I was just saying to Amy offline, I was thinking about ways to have this conversation with you because there's obviously so much to talk about. It's a very big issue. What's our duty here on Bloodstream? What are we trying to accomplish? So I want to ask this question like this. Pretend that we did Christmas, we did Happy New Year's and sang the song. I went to bed very tired and I did not wake up until today, April 7th. I've had a nap for about 100 days or so of 2025. And the other thing that happened during the nap is I lost most of my knowledge of how the government works, uh, especially as it relates to me and my bleeding disorder. So, having said all of that, Johanna, what's gone on that we need to be paying attention to? How does it affect my life? There's a lot of different headlines, but can you just give me the appropriate grounding here? What's happening and what do I need to be thinking about?
I mean, yikes. That's a big question because I think so much has been happening in the last 100 days or so. Where do we start? So President Trump took office towards the end of January, and since then, President Trump and his administration have done lots and lots of things to shape the federal government. What it does, what its priorities are, what the agencies are called. There are new leaders in most of those agencies. We obviously care most about healthcare programs, access, insurance programs, things like that. And there have been lots and lots and lots of changes that some of which, I'll be honest, we don't really know what they mean yet. In terms of, you're a person living with hemophilia, VWD, another bleeding disorder. There's lots of scary headlines, but what does it really mean for you today?
Right.
We know some things, but not all. What does it mean for you and your family and people you care about in the future? To sum it all up, there's been a really widespread change in the focus of the federal government that has really culminated in the last week or so in a whole reorganization of the Department of Health and Human Services, and a whole lot of people who work for HHS have lost their jobs. And whenever I talk about policy, it's always an alphabet soup, right, of federal agencies, and it sounds kind of boring and wonky, and sometimes it is, I will admit. But when I think about the folks who have lost their jobs in the last week, the programs that we're worried about going away, they're really important and do really kind of concrete things and have for many, many years.
Can you maybe cite a few of those programs just for reference?
Sure. So in no particular order, the Centers for Disease Control and Prevention, the CDC, since the 1980s, the name has changed, but there have been folks at CDC dedicated to hemophilia and other bleeding disorders. Now it's called the Division of Blood Disorders and Public Health Genomics. Again, really rolls off the tongue, right? But we call it the Blood Disorders Division. And since the 80s, coming out of the tainted blood crisis, it has worked to understand the impact, worked on blood safety. There's surveillance programs that come from, that goes through the HTC network. There are public health programs and partnerships with groups like NBDF and HFA to try to disseminate best practices. I can give you some more specific examples. But when you think about how small our community is, that there have been federal programs dedicated completely to serving us and our needs, and that those have come out of a ton of advocacy over the years by folks on this webinar or podcast and many, many others. And we're worried that those programs are going away because of these actions, and those will have concrete harm to the bleeding disorders community. Maybe not today. Again, there are things we don't quite know, but I worry really soon, and we're going to need everybody to join in advocacy to protect them.
So of the things that we do know, what do we know that's changing or going away, and what's most important, in your opinion, for, we'll say, your average community member to be aware of?
Yeah. So what we do know is that virtually all of the people who worked for the Division of Blood Disorders have lost their jobs. We don't know what that means for the grant programs and the activities that those people have been supporting and or funding for many years. And so we don't know what it means for, say, the Community Counts program, which is the surveillance program that if you've gone to your HTC, you've been asked, do you want to participate in Community Counts? That is the nationwide surveillance program for people with bleeding disorders and people with clotting disorders, I should say. It's not just hemophilia and bleeding disorders, but we don't know what it means for that. We know that as part of Community Counts, blood samples are taken and sent back to a lab at the CDC. For the last week, since this has happened, hasn't even been a week, which is mind-boggling. The other thing about 2025 time is weird, right? HTCs are being told now to hold off on sending blood samples because it's not clear what's happening to the lab. And is there somebody there to get the mail to put the samples in the freezer? I don't want to be flip about it, but we don't know. There are people who have been CDC employees who have been working for the lab forever. What's the plan? We don't know the plan for that activity moving forward.
Can you share, not just with hemophilia in particular, but why are surveillance programs so critical to public health?
Oh, I mean, that's like the whole ball game, Amy. Like if we don't understand what's happening, how can we design interventions to try and solve problems? How can we only know that HIV is transmitted through blood because of the hemophilia community and what happened in the 80s, right? Um, the lab has had blood samples dating back to 1996, and people still look at historical blood samples to try and do research studies and understand what's happening with the blood supply. But it's more than just the blood. If you go to your HTC and submit data, that's when we have information about joint disease and prevalence of inhibitors and interventions to try and address both of those. Like I know we all think that a lot more needs to be done to serve women and girls with bleeding disorders, but we only know anything about women and girls with bleeding disorders because of folks who have gone to HTCs and put in data into community counts and other surveillance programs. It's just how can we know what's happening if we don't know what's happening? And that is, the point of programs like this. And they're important not just for people with bleeding disorders, but especially all the blood safety stuff obviously has much, much broader implications than just for us.
There's also a portion of funding that goes to support the operations of hemophilia treatment centers, and that's gone on for a long time. That going away would be painful.
Is that going away?
So
Sorry, Patrick.
Oh, no.
No, I was just no. I'm sorry.
Better
to
question than I was going to ask. No, keep going. Please keep going.
So we don't know. So the CDC.
Okay.
So there's kind of two pots of money that go to support HTCs. CDC gives HTCs money to support the surveillance data collection. HTCs also get money from HRSA. We understand that some of the hemophilia program officers at HRSA have lost their jobs, but not all of them. So it's not the same. There's nobody there running the program anymore. But we also know that HRSA is going to be reorganized. A whole bunch of federal agencies are going to be smushed together in a new thing called the Administration for a Healthy America, kind of AHA, I guess we'll call it. And so we don't know what it means to be part of this new agency. And is everybody going? Are only some programs going and others will stop? We just don't know yet. So I don't want to be alarmist, but I'm worried about what happens to to HTC funding from HRSA after this reorganization happens.
And of course, this is happening during a time where industry support has also declined, and there's general concern about funding to support the services, programs, education throughout the community. So the context is a anxious one to begin with. I don't want to ask you to speculate too much, Joe, because I don't think that's particularly healthy. I also don't want to ask you questions that reach too far beyond your scope and expertise necessarily, but I don't necessarily know even what exactly those limits are. So I guess I'll
find
ask.
out in 30 seconds, apparently. Cool.
There's a wind-up for you.
Cool.
Please.
Joe, tell me from a fiscal standpoint, because I think like from an administration purview, they're really trying to quote unquote save money. In some way, they want to help, the fiscal health of the country. How big or small are these CDC programs, this blood disorder division? Like, is it a big weight, financially on the country to do this?
I mean, Amy, I think you know the answer to that question. A real softball up the middle. I appreciate that. No, I mean, these are infinitesimal sums of money when it comes to the trillions of dollars the federal government spends. The CDC has a couple different budget lines that relate to bleeding disorders, and it's a total of $8.6 million. $8.6 million is a lot of money.
Mm-hmm.
I don't want to be flip about that either, but these cuts are not happening our programs were not cut because they want those $8.6 million. It just it doesn't make sense. I think we also know that the investments in, say, the HTC network pay off in care that lowers healthcare costs.
Right.
So it's if we were doing complicated math, I would argue for adding to all of these programs and not cutting them. I don't think that's what's happening. I think it's a bigger picture skepticism about the role of the federal government and desire to radically narrow it. We're kind of getting swept up in that, I think.
I guess part of me just wonders, you referenced the advocacy coming out of the contaminated blood era, and I don't think that we're on the precipice of a catastrophe, the likes of which deserves comparison to that era. But it is so hard to get programs and policy passed and supported in the first place that my concern is the dismantling. It's not like switching the lights on and off. If we take these things away, how meaningful these things come back, if ever, just feels like a giant unknown. So I think I'm seeking to calm my own nerves, frankly, around the precedent for such disruption. And in your point of view, like you said, you're worried. What would you advise someone like me to be focusing on so as to not get distracted by the many headlines, the many speculative ways in which we can think about all of this? How would you help someone like me focus on what matters?
Good question, Bill.
How would you help me? Help me.
I'm so glad you called me here so I can help you personally. No, I think you're asking the right question, and I think it's a fair one, and we're talking today about impact on federal programs, but there are lots of other things that folks in the community are worried about that Congress might do or states might do or the federal government might do. So there's plenty to keep you up at night, or if you're up at 2 a.m. like I often am, there's a lot to think about. But I think we have had generations of advocates in the bleeding disorders community because of really awful things that have happened. And what have we been doing for the last 30 years coming to Washington to talk about these federal programs, if not to try to be ready for where we are today? You both have come to Washington Days and you have talked about these programs and other policy issues, and I've been asked a lot over the years, we're not really asking for more funding. Why are we still talking about the programs? Aren't there newer, bigger, sexier things to worry about? And I've always said, well, but we just want to remind everybody that these exist and they're really important to us. And if anything ever were to happen, we would want to come back to them and talk to them, and I really wish we weren't here with now things are happening and we need to go back to Congress. But I would say if you're worried about what to do, call Congress, call your senators, call the Capitol switchboard. It's funny, I'm so nerdy. It's my keychain, literally the Capitol switchboard number, but I'm at my desk. It's downstairs. But there's one number you can call. If you don't know what to do, there's one number you can call. I will pull it up while we're still chatting and give them your address and they will connect you with your senators and your representative. And today, all you need to say is, I'm Amy Board. Here's my address. I'm your constituent. I'm worried about the dismantling of the CDC Division of Blood Disorders. I ask for you to do everything you can to have it reinstated. You can hang up the phone, and that's all you have to do. There will be more. We are talking to our congressional champions. Congress doesn't know that any of this is happening unless we tell them. It's not like there's been an official list. Here are all the people who are fired, and here are the programs that are going away. They're literally crowdsourced lists on the internet where people are reporting things, but there's nothing official. So step one, that what we're kind of doing on our side is talking to congressional champions to tell them this is happening and to try to get organized on what's our next ask. How can these programs be maintained? How can these grant programs continue, et cetera? I can give you a million examples of why they're important. That's what we've been doing for the last 30 years. And now it's kind of hey, me again, folks who came to Washington Days were here literally a month ago and talking about these programs. So now's a great time if you came to NBDF's Washington Days to follow back up and tell people what has happened and that we need their help. I would never, ever, ever root against this community when it comes to advocacy. That's the joy in this. It's scary a lot, but that's the joy. And I don't know. How is this all going to get fixed today on April 7th? I don't know. But do I think it can be? Yes. And do I think we can do a lot? Yes. I don't know if that's encouraging to you, but
no, that was really encouraging to me. That was that helped me relax a little bit, hearing you frame the work that we've done for the last 30 years, if nothing else, preparation for a moment like this.
Yes.
Reframed my experiences of Washington Days and advocacy in a way that I hadn't quite thought about. Because on one hand, we know we're on the shoulders of giants and we build on the legacies that come before us, but actionably in the moment, for me anyway, I suppose it's just as easy to forget that and forget that we have built something that we can now lean into and have people like you who are in positions to help us focus on, from a policy perspective and advocacy perspective, organizing around that which matters most and has the best chance at success. And it's not up to me or Amy or any individual to solve that problem, but it's up to the community to work together to come up with a unified voice around how we move forward and then execute on that. I will ask, let's make sure that we put in the program notes that number. And I even love the copy, Joe, that you gave us. I think that's fantastic. So we'll make sure that's in the program notes for listeners and visually available on the screen for those who might be streaming this.
And how critically important, to reiterate what Joe said, that Congress doesn't know about this. There's no list. Like, we only know about this because this is so, instrumental to our community. Joe and her colleagues have been watching this like a hawk. Nobody knows. So
not only do they not know, but there's so many things for them to be focused on and having their attention pulled by. We have to be amongst the things saying, hey, we're in this too.
Yes.
Exactly.
Yes.
Yeah. And we've always been experts on bleeding disorder stuff more than our friends on the Hill, kind of by definition. But
sure,
shit is crazy right now. Like, it is impossible for anyone, me included, to know everything that's going on. And so I think people will want to be helpful to us, but we first have to tell them what's happening. And, to your point, all of the national groups are working together. It's like the number of teen calls I've been on and text threads in the last week has been kind of overwhelming, but also good, right? I think it's good to have NBDF, HFA, Coalition for Hemophilia B, the Hemophilia Alliance, AFIN, regional leaders, chapter leaders. It's like everybody is trying to figure out together what makes sense and how we can work together. But it has been a very collaborative, a crisis can be clarifying, right? So it's like, it's been very collaborative. I think everybody's on the same page and just trying to figure out how to be helpful. We all have the same direction. It's like, how do we get there?
Yeah. Well, that's also encouraging to hear, knowing that work is happening. I suppose I assume as a community member that some version of that is happening in moments of crisis, but to hear you explicitly say no, I'm in the group threads. Yeah, it's definitely happening is confidence inspiring. I want to explicitly invite you to come back on at any point that you think there's something that we need to let community know about. And it doesn't have to necessarily be level 5 alarming. If there's something positive as well, we can change the trend of the appearances by Joe Gray.
That would be delightful.
I would. Yes.
Can we talk about dogs or Taylor
Swift? I knew it.
Right?
Yes,
How are we not talking about Taylor right now? I mean, I guess our next time, but no. I mean,
we're here now. We're here now. You get 1 minute. Let's close on this. You get 1 minute to talk about dogs or Taylor Swift and leave us with something positive.
Oh. Do I have anything positive? I mean, my guy is snoozing behind me, so there's something, right? Has joined the call. I mean, I think I don't know if we share a love for this musical artist too, but that Bruce Springsteen, another love of mine,
Yes.
you guys are not Bruce fans,
Well,
announced like 7
Low
new
key.
albums coming out.
I
How
know.
can you be a low-key Bruce fan, right? Like,
I don't have merch. I'm not planning to go to concerts, but when Bruce comes on, I'm rocking with everybody
are
else.
you
Yeah.
an American? I mean, come on. Like, you want to feel
Wow.
inspired and patriotic and whatever. Like,
Yeah.
Bruce Springsteen is where it's at. And
It's where
Bruce
it's at.
just last week announced like 7 albums worth of songs that are coming out.
New songs?
Yes, Tracks Part 2, like not on albums but recorded. It's kind of Amy, you'll appreciate. It's like the Bruce version, so it's like songs recorded at the same time as his other albums that weren't released or out.
Wow.
That's
He
That is good
incredible.
needed
news.
like 100 new songs or like something
Oh my
crazy.
gosh.
He did.
Something
He did
crazy.
know.
It's the Taylor Swift effect, Joe.
Yes,
We had to.
I knew it.
Yeah.
I
No.
knew it.
Yeah. Okay. Well, this has
Knew
been
it.
mostly very good. Joe
No,
Gray.
but guys, I guess to say one last serious thing, like I've been including in talks a lot this year the picture of John McCain doing the thumbs down back in the middle of the night in 2017 for ACA repeal and replace. And like,
I was just talking about that an hour ago. Sorry, but I was
I
just
mean,
talking about that an hour ago.
it's everywhere, right? And it's like, I would not have predicted when ACA repeal and replace started
Yes.
that John McCain was going to
Yes.
be the dude to
Yes.
save the ACA.
Yep.
Yes.
You know, and he did, and God bless him for it.
God bless
you
him.
know,
Yep.
and we don't know who all of our friends are going to be
Mm.
in this fight, and all the others that are happening. You know,
Mhm.
but like things that seemed lost in my advocacy career in bleeding disorders weren't. You know, or we were able to get them back, and like. There's like that meme, you know, everything is unprecedented. You want to live in precedented times because that is not where we are right now, right? But like again, you know, we're not going to win every fight, but I think we're going to win some, and I know we're only going to win if everybody joins in. So like,
100%.
call Congress, connect with your chapter. Are you on the NBDF email list? Do you see their social media stuff? Are you talking to your HTC? Like all of it, you know, like. We're going to need everybody, and we're going to need everybody now. So like, that's my big finish. Like we're going to need everybody, and like, not tomorrow, not a month from now, today.
I have no notes. Thank you, Joe.
Thank you.
All right. Thank you, Joe. That was extremely informative. I want to
Yes.
reiterate what she shared. You can make a difference by simply calling the Capitol switchboard. The number is 202-224-3121. Anyone can call this number and get connected with their senators and representatives. And some quick bullet points on what you can say. If I was calling, hi, my name is Patrick Lynch, and I'm your constituent who lives in Los Angeles, California. I'm calling as a member of the bleeding disorders community, and I'm calling because the recent HHS RIFS, so that's the Reduction in Forces notice, the HHS RIFS has led to the entirety of the Division of Blood Disorders at the CDC being eliminated. I'm very worried about what this means for people with bleeding disorders and our country. Please work to restore the staffing and activities of the CDC Division of Blood Disorders. And that's it. Just that alone, if you make that call, it has to be logged by your senator's or representative's office. The more phone calls we make, the more logs of this that there are, the greater a possibility it is that we will be able to see change happen as a result. The number and those bullets are in the program notes. And if you have any question about where to call, what to say, what it all means, please reach out to us here. Amy's favorite email address, info. Mailbag? Ah, darn. I deserved
you
that.
finally biffed it. Oh my God.
No, I
thank
deserved
God.
I deserve that. Mailbag at bloodstreammedia.com. Amy.
Oh,
Anything else that you would like to share before we give a few comments on what we've just heard?
Well, yes, NBDF, I saw an email just right before we started recording that is now pushing out this information. So now I think it's going to become a thing. Don't just tell your bleeding disorder community folks to do this. Get your larger community involved. Put it on your Facebook networks. Put it on your Instagram, your TikTok networks. Tell friends at school. Tell friends at work. This is a really easy thing. I'm sure, as we've all heard, there have been, many phantom cuts here. And from NPR, actually, about 3 days ago, this is a statement that the HHS said. They said, HHS has said the restructuring is about realigning HHS with its core mission to stop the chronic disease epidemic and make America healthy again. It said roughly 10,000 employees were cut this week, and the cuts were focused on redundant or unnecessary administrative positions. And I think what is so contradictory to that statement is our own community. And we know that the monitoring, the surveillance of our community and the blood supply is essential to moving forward and protecting our community. And it's not just folks with hemophilia and von Willebrand's disease. Sickle cell is involved in this. We're talking about blood diseases and blood-borne viruses that could attack us at any moment. And this is truly, truly important. And I think the biggest thing that Johanna said that I didn't realize coming into this, I really didn't realize this. I know many of us have felt paralysis with this. Like, what do we do?
It's
What does one do?
There's so much.
Like what do we do? No one's talking about it in the news, so is it weird? Congress doesn't know about this. There's not like a list. It has been so.
And when you say this, they don't know about the impact on the blood disorders. They don't know about the blood. The people.
I don't even
so
think they know
on.
about what divisions were eliminated.
Yeah.
It's just this big,
Amorphous
giant
things are happening.
Things are happening. And the entire blood disorders division was eliminated.
It's gone now.
So Congress is our ally here. Mm-hmm. And so many of us in this community have relationships with our offices. Yes. So many of us do.
Some of us were decades long. Some of us were just there weeks ago.
Some of us have decades long. And I just want to reiterate what Joe said, which I just thought was just, it broke my heart a little bit. We all remember that evening. We all remember John McCain with that thumbs down when he was the saving vote for the
deciding
ACA.
Factor.
And in this fight, who is going to be our champion? Who is going to understand reason? Who is going to understand that these programs need to be reinstated? Because again, it has been done so in such a disorganized manner, it just doesn't make any sense. We don't know if the programs are going away. All we know is that the staff was eliminated.
Right.
And if the staff's eliminated, then who can administer the program? And it's so chaotic. And who is going to be our champion? And just the simple message to call that switchboard, area code 202-224-3121. And we've got quick bullets. They'll be in the program notes. They're all over NBDF. We're going to have them all over social media. I think it's really, 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 really important for us to get as many people as possible.
Let me direct your call.
Okay.
That was so awesome.
So we learned some things.
We did learn some things.
Portions of that, no doubt, will have to be struck because of permissions or lack thereof.
Yeah.
But what did we just learn? We learned that you immediately speak to a human being.
100%.
We learned that that human being will help direct you to the next human being.
100%.
We learned that that second human being, in addition to logging your info and your message, may connect you with that another human being.
Yes.
But there are human beings all over the place when you call the Capitol switchboard. That's what I just learned.
How long did that take you?
That was like
James Lynch?
3 minutes.
Yes.
3 minutes.
Immediately. You don't have to, you're not going to be on hold?
Nope. That was very, very quick. Somebody answered the call. They gave me direct information. So there it is. Again, we'll have to strike some of that because we only have the permission we have. But it's an easy phone call to make, and the impact can be profound. So please make that phone call. All right, Amy Board, our next episode will be coming out on April the 25th. So with a little bit of thanks to Johanna for appearing today, as well as to Takeda for always supporting the Bloodstream podcast.
Always crushing it.
What can we let listeners know to expect on April 25th?
Well, we've got an awesome gene therapy segment for you that Hannah's been working on, which will be great. And then we're going to let you know any updates about the CDC elimination situation. We're going to continue with that. And then we have some fantastic interviews that have had to been pushed and squeezed and shoved, and we're really excited. We're going to hear from several of our, and this is always a mouth jumble for me.
Mouth jumble it.
NYLI
Nice.
members.
You did it.
I did it.
Yeah.
National Youth Leadership Institute
You're good.
members.
Yeah, you got it. You got it.
NYLI, 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 NYLI. Anyway, they're fantastic, and it was a phenomenal conversation, and they're awesome. So make sure to tune in for that.
Fantastic. Well, with that, thanks again to Johanna for coming on today's show and helping us learn a lot more about what's actually going on and what
Thank
we
you,
can
Joe.
do about it. And with that, that is all for this episode. Be sure to subscribe if somehow you haven't already to the Bloodstream podcast wherever you listen to have that next episode delivered to you the moment it goes live.
And loyal listeners, as always, email us at mailbag@bloodstreammedia.com.
There it is.
You can inquire about casting opportunities. You can also tell us your stories, how it went, advocating for what we need in our bleeding disorder community.
Let us know.
Please let us know, and you can always find us on social media.
I am your host, Patrick James Lynch.
And I'm your other host, Amy Board.
And until next time, take self-care of yourself. Bye, everybody.
Bye.